if you're now at a point where you've finished this process and you had a joint replacement, first of all, welcome home. I hope that it was a smooth process. I hope that you're satisfied with the care you received while you were at Island Hospital with us. And I hope that you're home and recovering well. Now, let's talk about what we can do now that you're home to make sure that we keep you on a good trajectory towards a positive outcome. The number one thing that you can do as you're recovering from your joint replacement is follow my 5 rules for recovering at home. These are: number 1, do not fall down. Number 2, do not fall down. Number 3, don't fall down. Number 4, please, please, please do not fall down. And number 5, you guessed it, don't fall down. There is nothing that can cause a complication faster than having a fall. And there are several strategies that you can use to help avoid this. The first one is don't be a hero. Don't try to do things that you think might be dangerous. If you need help, ask for it. And that's why it's so important to have people who are with you at home as you're recovering. The next is using ambulatory aids. I want you to use a walker until you're 100% positive you're not going to fall down if you use a cane. And then I want you to use a cane until you're 100% positive that you're not going to fall down if you don't use anything at all. And during your initial recovery, you probably have stairs to get into or out of your house, but I want you to limit your use of stairs inside the house by trying to set up your house so that you're on one level as much as possible. All of this is just working at trying to make sure that when you're upright, you stay upright, because falls are the number one thing that can cause an issue for us in the early process following a joint replacement. After your joint replacement, you'll have been sent home with a dressing. And the dressings that we use are waterproof, which means you can shower in them. However, if your dressing loses its seal and water starts to seep underneath it, it has to come off immediately because we don't want water pooling next to your skin underneath that dressing. So keep an eye on it. And if you see that the dressing has lost its seal, I want you to take it off and call our clinic so that we can get a new one for you. You may see some spotting on your dressing, and this is okay. You just had a major surgery and there may be a little bit of bleeding. We would want to know if any of that bleeding is overflowing the dressing, if it's not maintaining a seal anymore, because then the same thing is happening. You're getting blood that's pooling against your skin, very similar to the way we wouldn't want water to pool against your skin. I don't want you in a bathtub or a hot tub or any other area where you'd be submerging that dressing underneath the water, and we'll have you avoid that until the wound is completely healed. There are a few things that may be worrisome to you as you recover from your joint replacement that I don't want you to be alarmed by. The first is bruising. There will be bruising around the surgical site. We know that it's coming and it's okay. The second is swelling, and the swelling can actually be pretty dramatic, particularly if you spend much time upright, either in a chair or standing throughout the day. You may notice that the swelling goes all the way down to your feet. I have people very frequently come back from joint replacements for their early follow-up visits who are having trouble getting on their shoes because they've got enough swelling that's going down to their feet. It's why earlier we referenced using a low-sodium diet to try to limit that, and why icing is so important, as well as some other steps that we can take to try to limit your swelling, which we'll talk about later. Another thing is itching around the surgical site. This is very common to occur. It's from the nerves regrowing through the area that we operated on, and it may cause little zaps or a sensation of itching, which is almost always temporary and is coming from those nerves regrowing through that scar. There can be numbness or tingling on the outside of your leg. Again, some of that is permanent, as we referenced earlier in the video series. But you may notice this earlier after the surgery, that you now have a patch that's numb that wasn't numb beforehand, that's just on your skin. And then the final one, as we referenced earlier, is spotting on the bandage. If you notice a little bit of spotting, that's okay. We want to know if that is getting to the point where it's compromising the dressing. If there's a little bit of blood on it and the dressing is still maintaining a seal and it's still dry, then we're okay to just keep an eye on that. A few things I do want you to let me know about if you experience them are bleeding that overflows the bandage, any opening of the wound where the wound is pulling apart in the area where we sewed it closed, any pus coming from the incision that looks like it's an infection, any fevers, that means a temperature greater than 101.5, or a red hot swollen calf, that might be an indicator that you have a blood clot in your calf. If you're experiencing any of those things, I want you to call our clinic and let us know, and we will be able to direct you with next steps to take if you're experiencing any of those things. One of the biggest challenges following a joint replacement can be sleeping. It's uncomfortable and it's hard to fall asleep when you're uncomfortable. And there are some things that we can do to try to help you sleep, be doing every day regardless, but they take on extra importance after you had a joint replacement because of the increased difficulty associated with sleeping.
One of the main goals of sleep hygiene is to learn to associate being in bed with being asleep. And so the first rule of sleep hygiene is to only use your bedroom for sleeping and intimacy. You want to train your mind to associate the bedroom, and especially your bed, with sleeping and nothing else. Because most people who sleep poorly associate being in bed with lying awake, not being able to fall asleep. And we really want to train our bodies to associate being in bed with sleeping, because that makes it much more likely that we'll fall asleep when we go to bed. So don't bring your laptop or phone to bed. Don't study or work in your bed. Don't have a long problem-solving session with your partner in bed. And don't laze around in bed once you wake up. If it helps you to fall asleep, you can read or watch TV in bed for up to 30 minutes before you go to sleep, but no longer than this. If you like to read or watch TV for longer than half an hour to help you wind down at night, then start off somewhere else, in the living room, on the couch, and then only move into your bedroom and bed once you're ready to fall asleep. And only go to bed once you're already feeling drowsy. Otherwise, you'll just lie there in bed, unable to sleep. And then, if you've been in bed for more than 20 to 30 minutes without having fallen asleep, lying in bed any longer is unlikely to bring on sleep anytime soon. You're just teaching your body to associate being in bed with lying awake, rather than falling asleep. So after 20 to 30 minutes of being in bed, unable to sleep, get up and move to a different room and do something relaxing for 20 to 30 minutes, like reading a book, or listening to some quiet music, or doing a relaxation exercise like the one I linked to in the description. And then return to your bed only once you're feeling sleepy. And try to keep your bedroom dark, quiet, and relatively cool. Our bodies cool down at night as we prepare for sleep, so if we keep our bedrooms too warm, it interferes with this process. And most people find they sleep best at a room temperature in the mid to high 60s. And sleeping well isn't just about what happens once you go to bed. The hours leading up are important as well. Try to stay off your computer or phone for 30 minutes to an hour before bed, and use a blue light filter on any devices you can as bedtime approaches. And don't eat a big meal, drink alcohol or caffeine close to your bedtime. And nicotine is a stimulant, so avoid smoking right before bed. And try to have a nighttime routine that involves some relaxation before you get into bed. Doing some yoga or meditation, or taking a bath, or just reading or watching TV. Or even cleaning up the kitchen if you find that relaxing. We all need something to help us unwind before bed. If you're working right up until bedtime, or dwelling on things that went on during the day, or worrying about tomorrow when you get into bed, you're probably not going to be able to quiet your mind enough to fall asleep. And now we're going to look at sleep scheduling and how that can help us sleep better. One of the most important things we can do to promote good sleep is to keep a regular sleep schedule. Our bodies rely on a consistent 24-hour routine, or circadian rhythm, to regulate our sleep-wake cycle. Our bodies get used to going to bed at a certain time and waking up at a certain time. That's why if we get up at the same time every day, we often wake up just before our alarm goes off. Our body knows that it's time to wake up. It doesn't need an alarm to tell it. The more we can stay consistent and let our bodies get into the habit of knowing it's time to go to sleep and it's time to wake up, the better our sleep will be. And the less regular our sleep schedule is, the less we can rely on our body's internal clock to help us sleep, and the more we start fighting against it. And so keeping a consistent sleep schedule is one of the best things you can do for your sleep. And that's one of the things that makes sleeping so difficult for shift workers or new parents whose sleep schedules are constantly getting disrupted, or when we travel across time zones or experience the effects of daylight savings time. And it's important to try to maintain the same sleep schedule even on weekends. If you're so tired at the end of the week that you need to sleep in, try to limit it to no more than half an hour. If you're sleeping in a few extra hours on the weekend, when you try to get back to your regular routine on Sunday night, you're probably going to find it hard to fall asleep. And difficulty sleeping Sunday night is one of the reasons we can be so cranky on Monday mornings. And if you need to take a nap, these are fine earlier in the day, but try to keep them to under 45 minutes. Otherwise, it can disrupt your sleep at night. And having a nap later in the day makes it more difficult to get to sleep at night. So a nap in the morning or after lunch should be fine. But a nap after work or after dinner can make it harder to fall asleep when you go to bed.
Now, if standard sleep hygiene practices are making it so that you are struggling to sleep, a lot of times people will use medications in an attempt to help them sleep. And I think that's something that's important to work through with you as we're trying to tailor your recovery from your joint replacement. The simplest medication is melatonin. And I think this probably makes sense to take regardless of whether or not you're having sleep issues as you're recovering from your joint replacement. Melatonin is a natural substance that just tells your body that it's nighttime and has minimal side effects and probably makes sense as a component of your regimen as you're trying to recover and get restful sleep. There are several other medical options that we have for you that we can talk about as well. The one that people use most often is the opioids that we prescribe for pain because it will have a sedating effect. I don't want you to use your opioids as a sleeping aid. If that's how you're using them, there are alternatives that we can work through with you that will have much, much lower side effects. The first one is Benadryl. Benadryl we're all familiar with from its antihistamine effects, but it also makes you drowsy. If you're just looking for something to make you drowsy so that you can fall asleep and you've got your oxycodone or the Benadryl, please reach for the Benadryl. Another option is Ambien. This is a prescription sleep aid. It can have some side effects, the most common one being people having really bizarre dreams of all things. But if you're struggling to sleep, let me know, and I am very quick to prescribe Ambien for you to try to give you that as an option to help you sleep. And then the last one that we should talk about is marijuana. We're here in Washington. Marijuana is legal, and a lot of people use it. I personally think that the side effects associated with marijuana, whether that's THC or CBD or any of these new acronyms that anybody has come up with, is much, much lower than the oxycodone or other opioids that you may be prescribed. The challenge with this is that it's very difficult to tell you what dosage to take or what formulation to take because we don't have a lot of evidence about the impact of specific dosages of marijuana formulations on sleep relative to others. And so it's something that I think has a role to play in your recovery from a joint replacement, particularly if you're having sleep difficulties. Unfortunately, I don't have a lot of expert advice to offer about what formulation or what dosage you should use, with one exception, which is I really don't want you smoking anything. So I wouldn't want you to roll up a newspaper and smoke that. And I don't view marijuana any differently. Anytime you're inhaling smoke, you're getting a lot of carbon monoxide and other things in the smoke itself, other than the marijuana products that you're trying to ingest through inhalation. So if you're going to use marijuana, I would just ask you to use it in a non-smoke formulation, whether that's a tincture or a gummy or something else, so that we're not getting smoke in your lungs along with the marijuana that you're using to sleep. It's very common for patients to ask me when they can get back to driving after a joint replacement. And it's a hard question for me to answer because you might have been the worst driver on the road before you had a joint replacement, and that's not going to be fixed with surgery. And so I don't know if you're safe or not, but what I recommend is that before you get back on the road, number one, you have to be off all opioids, but you have to be sure you can hit the brakes fast enough in an emergency. And there's no better way to figure that out than by testing it. So that means going to somewhere that's a protected environment, like an empty parking lot, and driving around and trying to slam on the brakes, simulating, a kid running out in front of your car, or the car in front of you slamming on their brakes to see if you need to stop that car abruptly, if you'll be able to. Now, studies have shown that on average, after a right-sided joint replacement, either a right knee replacement or a right hip replacement, when you need to hit the brakes with that operative leg, patients have their brake response time return to preoperative at about 3 weeks. And so that gives you a rough gauge of when you might hit that point. But again, I want you to test it before you get back out on the road. In terms of what to expect with your initial recovery following your knee replacement, this is an infographic from another surgeon named Howard Lukes that I think is incredibly helpful. Here you can see during the initial recovery saying, it's not as bad as I expected. I thought they told me this was going to be tough. I'm flying high. This is great. And then very quickly, we move into the swelling phase, and the knee gets very swollen. And this can be uncomfortable, and it can lead you to, in that, around that 1 month time frame, thinking, oh no, did I make a mistake? I didn't realize I was going to have this much swelling. Hopefully, when you hit that point, having watched this video, you'll have known that it was coming. You'll have known that the knee was going to get really swollen and have been doing things in anticipation of that to try to address that swelling proactively. As we move forward from that acute swelling phase, we hit a point where patients will say, okay, I'm still having trouble sleeping, but I can at least see that I'm getting better. And that's around the 2-month mark that patients will be saying that to us. And from there, it's an upward trajectory. There will be times when you're getting better. You may find that you have a setback, particularly after you've been particularly active. You may find that the knee swells up more with activity. But over time, there's kind of this waxing and waning out to the point where 85% of patients eventually say, yeah, I'm glad I did this. It was worth it. And that initial recovery with all that swelling was tough, but in the end, I'm glad I did it. So what are the things that you can do early in the recovery process to try to limit that swelling? This is something that's been called a quiet knee protocol. And this is how I want you to engage with your recovery in the first couple weeks. A lot of times people think, all right, I just had this surgery. I said that I was going to work hard, and darn it, I'm going to get to work. And they'll want to go out and do a bunch right after surgery. That is not what we want you to do with your knee. We want you to give your knee time to heal. And so for the first 2 weeks following your surgery, I want you to straighten it all the way out and bend it as far back as you can with your own muscles. But I don't want anybody else to be pushing that. I don't want you to take and push the knee to get all the way straight or push it to bend as far as it can. Just do whatever your muscles are capable of generating and move it as much as you can, but only move it with your own muscles. I want you to ice a ton. So this means 20 to 30 minutes every 2 hours. That's a lot of ice. And if possible, combine that with some form of compression so that we're trying to deal with the swelling, both with the ice and with the compression. I don't want you to stand up for more than 20 minutes at a time. And I also want you to take less than 1,000 steps per day. So that combination of those last two, not standing for 20 minutes at a time and not walking more than 1,000 steps, means you're kind of taking it easy. But that's what we want you to do. We want to give your knee time to recover and begin to heal and not be continually inflaming it and provoking these cycles of swelling that can be hard to play catch up with. As you're recovering at home, sometimes it can be helpful to have a model of what I want your recovery to look like. And we actually have one here. It's my uncle. And this is my Uncle John recovering from a partial knee at his home. Before you ask, the answer is no. Obviously, I did not do his surgery. But as he was recovering and I was talking to him about what I wanted him to do and how he could best position himself for a good recovery from his partial knee, this is what he came up with. And I thought it was perfect, and I wanted to share it with you guys. So what you can see here is that he's resting with his knee straight. He has weight underneath his heel, and there's nothing underneath his knee so that he can straighten it out as far as he can. You can see that he's elevating it. His knee is above his heart so that any of the fluid that's accumulating around his knee is going to drain downhill towards his heart rather than downhill towards his toes. He's icing, which I love. I love that he's icing. You can't do it enough. It's fantastic. And then finally, he's gotten outside, and he texted me the day after this and said that he was getting bored of being cooped up in the house. Get outside a little bit, get some sunshine. While you're a little bit inactive during this initial recovery phase, it can be a little bit frustrating, and you're likely not used to being this inactive. So get outside, get some sunshine, enjoy the yard, and try to recover mentally as well as physically by enjoying this little bit of a break that you're getting during your initial recovery. Anytime that you're resting, I want you to have something underneath your heel, not underneath your knee, so that the knee is resting in the most straight position that you can generate. Here you can see a graph of pain levels following a knee replacement. And the big thing to see is that they get better every single day. So you're going to continually experience less pain today than you did yesterday as you're working through this recovery process. So just take some hope in that and be patient, because as your body recovers, you're going to see those pain levels dropping. So that concludes this video series. I really hope that this was helpful for you as you've gone through this process. Moving forward from here, if there are ever issues that come up related to your hip or knee, whether or not you think that it has anything to do with the implants that I put in, I want to take care of it. I want to take care of your hip or your knee for the rest of your life. And so the clinic number is included here. If things come up, if you have concerns, please come back and see me. I will have scheduled visits with you on a routine basis moving forward. Additionally, I don't want to just know if things are going bad. I want to know if things are going good. If there are things that you get back to that you couldn't do without your joint replacement, particularly if it's the reason that drove you to have this surgery in the first place, I want to celebrate that with you. And this isn't just trying to seem cute. This is a big deal for me. It makes my day anytime somebody says, "Hey, I really wanted to go hiking. I couldn't hike. You replaced my knee, and check out this picture from the top of a hike," or "Look at this fish I caught." Hey, I took my grandkids to Disneyland. Whatever it was for you that motivated you to have the surgery, if you've gotten back to that, please share it with me. It really means a lot to me, and it's the reason why I do what I do. And I've got an email address here where you can send a picture of anything that you're doing after surgery, and anytime something comes through there, it really does make my day. This email is not monitored regularly. I check it on a very irregular basis, and so it doesn't serve as a way to communicate with me about your care. It's really just there for you to be able to share those victories and those milestones with me, and I check it occasionally in order to see what my patients are up to and get a little bit of a boost from you guys, because this is why I do what I do. I want to see you get better, and I want to know that you did. So again, thank you for trusting me with your care, and I look forward to seeing you again in the future.